Rob, we're going to have to wait a few minutes because we need quorum.
Nah. Veronica's definitely coming.
Mike Sigler was here earlier and he's picked up his packet. He plans on attending remotely. Yeah.
Randy and Travis. Just me and you for now. We ready? Good afternoon, everybody. Welcome to the Wednesday, June 15th, 2022 Health and Human Services Committee meeting. Are there any changes to the agenda?
I don't have any changes.
Very good. I don't either. And I assume we have no public comment. I don't see anybody. Okay. And I don't have a chair's report at this time. So let's keep going on the agenda. Is there anyone from county administration here? Okay, we can come back to that later on. That leads us right up to our presentation. We have decided this month to have a little focus on suicide prevention services in Tompkins County. This is something that I don't recall the legislature doing before. And so as I've been told, it's about time, I guess, is how I would sum it up. We should be focusing on this from time to time. So we have two people with us who are going to do a little presentation, talk with us a little bit, and be available for questions and answers. So we've got Tiffany Bloss, the Executive Director of Suicide Prevention and Crisis Service of Tompkins County. And we have Melanie Little, Education Director for the Mental Health Association in Tompkins County. So let's see, Tiffany's with us in person. Melanie is zooming in. Tiffany, you want to come on up to the table? Pick a seat you like, anywhere. And I think I'm going to have you guys get us started.
Okay.
Sound good? So take it away. It's all yours.
Great, thank you. I'm just going to share my screen. All right, so thank you guys so much for taking on this topic. I think it's really important, especially right now in the community. So I want to share a little bit of history of suicide prevention and crisis service. We started in 1969. The year prior to that, in 68, there was a lot of local students that were dying by suicide. So there was some local Ithacans that lobbied the need for a 24-hour crisis service center. Reverend Jack Lewis, who you'll see on the screen there, was a director of Cornell United Religious Work, and he's the one that took the action upon himself. Throughout his tenure at Cornell and as part of the Ithaca community, he's created several community-based organizations, including suicide prevention and crisis service. 1969 was when he took his very first call, and he was able to support the young gentleman who made that phone call to renew his hope. And in that first year of establishment, they took over 380 calls. Suicide prevention has been a long-term nonprofit community here in the organization, and we were developed because there was a strong need, and we're here to fulfill that mission. So we have continued to grow with the need for our services. In 2021, we received over 6,000 phone calls. We are open 15 hours a day right now from 10 a.m. to 1 a.m., 7 days a week. And that is completely manned by 11 staff and 10 volunteers that we have doing all of those shifts. Our needs are continuing to increase, so we are trying to increase our staffing and provide additional services so we can meet the needs of our community. Some things that people may not know is that we are not just based in Tompkins County. Our reach is actually 11 counties in New York State. You'll see those listed on the sign. So we do have a local number, the 272-1616 that people can call, but then anyone that has a 607 area code that calls the National Suicide Hotline, that 800-273-TALK, comes to us. So that could be if you set up your phone here and it was 607 and you move out to Oregon and you call the national hotline, you're going to get our local center. So right now, all of those counties that are outlined are the service areas that we have. We are continuing to build relationships with all of the counties that we serve so that we can increase access to their resources and mobile crisis teams and understand how things work in each of our individual counties. Coming very soon is 988 that is launching nationwide on July 16th. We're really excited about this because it gives easy access to people who are struggling with a mental health crisis. This will be America's very first 3-digit mental health crisis line. This was approved by Congress in 2020, and even before the pandemic, the mental health crisis was on the rise as it continues to be today all the way across the nation. So they found a need and are fulfilling it. This is a great alternative to 911 for anyone in a mental health crisis because it will help to free up those emergency services and we can take on those mental health people. So in order to implement 988, there's a lot of moving parts to this. Our local number, that 272-1616, will stay, but anybody who calls 988 will be routed through the National Suicide Prevention Hotline, and that will come to all of the designated call centers around the nation. The 800 number will still be available, but this just makes it a little bit more easy access for people to say 988 instead of a 10-digit number. We're working very closely with several organizations on how to implement this. We're in constant communication with Tompkins County Communication Center so that we can make sure that we have a very collaborative approach when this is launched next month. As we are working on increasing our capacity, the goal by the end of next year is for our services to be available 24/7. As I said, we're only 15 hours right now, but we need to increase that. And with that becomes increased staffing and volunteers. We are working now with a brand new class of trainees to bring on 6 additional staff, but we are trying to recruit more so that we can offer better services. We right now have 2 people on the lines at all times that can take care of phone calls, but our ultimate goal is to have 3 along with an admin on call to help triage imminent cases. So we also do a lot of community education. We work with Cornell. We do a lot of tabling in the events. We are doing presentations like these, and we're really proud to be presenting ASSIST at the end of this month. This is Applied Suicide Intervention Skills Training. It's a 15-hour workshop. We are offering it completely free, open to the community, and I'm proud to say that we've had a lot of people register for this service. So I think that we're gonna be able to make a lot more people alert and be able to do some of these interventions. We've also got a lot of community partnerships that we work with in the area. We sit on a lot of committees so that we can make sure that we're talking about mental health in all of the aspects that it have, and that is continuing to grow in Tompkins County as well as our surrounding counties that we service. We are really in our infancy stages of suicide prevention and crisis service right now. I was brought on in April, so it's only been a couple of months. And just last week, we brought on a director of operations, which is really great. And we've got a couple other leadership staff that we are bringing into the organization to help us manage everybody and to be able to sustain and build these programs. And then crisis line counselors and workers, we are going to continue to forge forward and train those folks as we can so that we can really support our mission. And I believe we have the ability to do this and expand our services for the community.
Wow, thank you. I had talked with you and everybody that presents here to, to try to be really compact, and wow, did you really do that? Thank you. So let's pause there and ask if there's any questions for Tiffany at this time. And then after we do that part, we'll get to Melanie, and then we'll have another set of, another time for more questions. Any questions for Tiffany at this time? Veronica.
I'll have more questions after hearing from both of you. But right now, if someone calls the SPCS number outside your hours, what happens to the phone call?
So we have a backup center. All the call centers that are not 24 hours have a backup center. Ours is located in Syracuse. So 100% of the time somebody gets connected with a counselor.
Thank you.
Any other questions at this time? Okay, thank you. Stand by. Okay, next up, Melanie Little, Education Director, Mental Health Association, Tompkins County. Melanie, you're on.
All right. Yes, thank you so much for having us. We really appreciate the opportunity to share about our services. I'm going to share my screen here. Get our slides up. Okay. So in terms of, with this topic of suicide prevention, I just want to take a moment and acknowledge that, suicide and different crises don't happen in a vacuum, right? There's really this continuum of mental health and wellness that people experience, and that requires a spectrum of services, right? So we're really fortunate to have suicide prevention and crisis services. And at Mental Health Association, part of what I'll talk about is that we are also really looking at early intervention, prevention, and maintaining recovery so that we can support people in either coming back from those crises and avoiding them in the first place. So the Mental Health Association, part of what's unique about us in our community is that we are a peer support education. That means every single one of us here have lived experience with mental health recovery, and we share that experience in the way that we support others. We've been around since 1954. We were one of the first local affiliate chapters of Mental Health Association, which is national and statewide as well. So just a quick look at our mission statement here. So our mission, in cooperation with Mental Health Association in New York State and Mental Health America, will develop and maintain a coordinated citizens movement for the promotion of mental health and well-being in Tompkins County. So as a team of peer specialists, we draw on that lived experience as well as specialized training to empower individuals, families, and groups through peer support, advocacy, provision of services which promote mental health recovery, prevention, and early intervention. And we're also advocating for the human and civil rights of people with mental health concerns. So that happens through educational programs, community conversations, talking about stigma, barriers to access, and really just kind of trying to change the conversation that we have about mental health and recovery. So part of what makes us unique are the perspectives that we take coming from our lived experience and our values. So we certainly have a commitment to quality. We recognize that very often people who are struggling, especially with severe illness, don't always get treated with respect and dignity. And that is really important to us, that this is a space where they receive that. We are very much interested in including as much voice and choice as possible from participants in our services and helping them to be more collaborative in the services they receive elsewhere. We work from a strengths-based framework. We're looking at increasing people's capacities as individuals, families, professionals, and a community at large to address these mental health needs. And we really look to promote people's active involvement in their own recovery, that this is something that they can really take ownership of. And we believe in hope and fun and laughter as really integral parts of our connection with one another and our ability to both recover and maintain that recovery. So that really informs a lot of the way we approach our services. So what are we talking about when we talk about peer support? A question I get a lot is like, what is the difference between peer support and therapy? So in part, well, it has its roots in this origin of the self-help movement and really identifying that people who have these lived experiences are the experts on themselves, know what they need, know what to do. And it really stemmed out of this civil rights movement as well for people who were in psychiatric care. Kind of moving beyond this idea of symptom management and helping people to really create the life that they want to live. So as peer specialists, we're sharing knowledge from our lived experience, what we've learned about the systems we've been in contact with. We provide emotional support, practical help, like maybe accompanying someone on that first ride on the TCAT that they're really nervous about would be an example. And we also support people with advocacy in systems and developing their own self-advocacy skills. So we work with folks one-on-one, we work with folks in groups, we work with family units, and we try to be as low threshold, and all of our services are voluntary for folks. So in terms of just the skills that a peer specialist would bring to the table, our real focus is number one on listening and connection and being able to provide that, really modeling this recovery and resilience. And we also go through some intensive training to be able to do this work in addition to the work of our own recovery. So as peer specialists, we complete coursework. We have to have 3,000 hours of peer support work with regular supervision, and there's an application process through New York State. And we can also support people in linking to additional services as they're transitioning out of other service systems. So recently we've been doing more work in the hospitals, in the jail, in the courts to support people as they're going through those really stressful life transitions that could potentially lead to a crisis. So we're really proud to say that every single one of us here is either a certified peer specialist or has their certification pending. So that includes administrative all the way down to our newest part-time staffers. 2 of our staff are also credentialed family peer advocates, which means that they have the lived experience of raising children with mental health challenges. We have a young person who's a credentialed youth peer advocate, so dealing with these challenges as a minor. And we're all also trained in mental health first aid, and 3 of us are trainers for that program. So, going back, another thing that we do offer is we support people in pursuing their own peer specialist certification. This can be a really, going back and forth here, can be a really empowering process for people to be able to share those skills. So this is just a quick menu of our services. I'm not going to read them all off just for the sake of time, but you can see that we have many different support groups and services that we're offering, as well as a lot of educational support. We go into the schools, into health classes. We provide mental health first aid training to many different groups. And another resource that I want to highlight is this peer support warm line in the middle there. And that line is for folks who are, maybe not quite in a crisis, but they're looking to connect with someone. Maybe they're feeling isolated, maybe they're feeling overwhelmed. They just need to talk through something with a non-judgmental listener. And that is an additional support that we provide as well. And very often people are more comfortable talking to a peer specialist if they have some discomfort, perhaps talking with more of a clinical professional, because we can relate to the things that they're going through and can't be candid about that. So on this slide, and again, I won't read through all of these, but you can get a glimpse kind of at the breadth of lived experience that us as staff here have at the Mental Health Association. And a lot of these experiences are things that are really stigmatized, that a lot of people may have never encountered a service provider that would be willing to say, yeah, That's happened to me too. Of course, we're always sharing from a strategic, skillful point of view to help combat that isolation and support the person in feeling of hope. But there's something really valuable to sharing that lived experience with folks. And I think that's part of why people feel comfortable here. And another thing that is really key to keep in mind with peer specialists is the importance of appropriate supervision, which is something that we're really uniquely positioned to provide here. It's unique work and we're unique people, right? So peer specialist supervision has a lot to do about understanding that unique role of the peer specialist, as well as how we maintain our own recovery through that process. So I know that there's a lot of interest in other organizations in expanding peer services. And this is something that we're really excited about and interested in sharing what we've learned about supervision and how those things work. And just to close out with kind of an exciting announcement, we've had a new development. We are going to be opening in September a peer outreach center. So some folks may remember when we had the Jenkins Center in our old location at the Henry St. John building, which was a drop-in center. And with COVID, that kind of fell away a little bit. So we're now in the Center Ithaca building, and we have leased a space downstairs with a commons facing entrance. And this will be our new psychosocial drop-in center for folks to come in, engage in support services, connect with peers, work on maintaining that recovery and those skills. We know that isolation is a really huge risk factor for folks and can really send people into crisis. So our hope is that this service can really be a protective factor for folks who are either developing some challenges or are recovering from them. And we're really excited to partner with other organizations to help link people to services and provide more education and support in that way, as well as our own trainings that we offer. So that is what I have to share.
Thank you, Melanie. Wow, that is a lot of information.
Yeah.
Do we have questions for Melanie? Let's see, I had something. Give me a sec here. Oh, yeah. So, I see Randy's hand. Go ahead, Randy, you go first.
Yes, thank you both for that presentation. A lot of information and is a lot to take in. But I agree that mental health is probably the most worrisome thing I think about in my neighborhood and in schools, especially from I hear from various people. So thank you for doing this and the work. And 3,000 hours is a lot of time. So you get training, and thank you for doing that. One of the things you mentioned was early intervention and socialization. And what do you mean by early, what's early to you, I guess?
Yeah, that's a good question. So something our parent organization, Mental Health America, talks about is this sort of before stage 4 philosophy. So when we think of that stage 4, that's the crisis point, right? And a lot of people don't connect to help until they're there, right? Until they're going to the hospital or their lives are, kind of falling apart. So part of what we do in our education is to try to support people in recognizing when things are starting to slip. So early warning signs, when people's lives are starting to be disrupted. And that's also something that we work with peers on, is recognizing what are our own early warning signs. So, kind of before things are falling apart, crashing and burning, whatever that feels like for the person, maybe this is where relationships are starting to struggle. Right? Or feelings are starting to become overwhelming. And there's just kind of this disruption that's creeping up. And we know that if we can recognize that and shed some light on it and provide some support and caring at that point, people are going to have better outcomes, and they'll also have more power to do something about it. Does that answer your question?
It does. The other thing you mentioned was socialization. And
yes.
I worry an awful lot about our youth that are becoming isolated, and COVID made it a lot worse. Yeah. And I'd like you to talk about socialization in youth, and you talked about supporting and directing to other programs, interacting with them. I think that's great. Just like to get your thoughts on that.
Yeah, definitely. So, one thing that we do offer here is we have a weekly activity group for youth, where we do art and games, and it's an hour every Thursday. And I always tell youth it's not a space to sit around in a circle and talk about your feelings, but it's a place to enjoy each other and get that socialization. And I think, it's definitely been my experience in the past few years of seeing a huge increase in social anxiety among youth coming from this isolation. And, I think we're, as providers, all kind of at a point with struggling to figure out what the answer is for that and how to connect folks. I think that one thing I'm starting to see that's hopeful is teens are more interested again in getting jobs and getting out and doing things and getting back into the community, and are kind of hungry for that. And there's a lot of anxiety attached to that as well. So I know lately a lot of what I've been doing with folks is trying to draw out, what are you interested in? What are you willing to try? Here are the things that maybe you don't know about. And with your mental health, what is it going to take for you to be able to participate in these things?
Right. That makes sense to me. I've got a lot of other questions, but I won't take any more of your time, and maybe we can talk again.
Yeah, that'd be great. Thank you.
Melanie, over the years, I've always, been a little confused, I guess, or unclear about the differences between the different mental health groups in the county. And so I think you laid out really well a lot of the differences between you and our own county mental health department. I was also wondering about NAMI, that organization. Can you talk a little bit about differences in your approach or between theirs and yours? Thanks.
Yeah, definitely. So NAMI is a fantastic organization, and we've collaborated a lot over the years. My understanding is that NAMI focuses a lot on parents and caregivers and loved ones of folks who are dealing with serious mental health concerns, which is really critical, right? Because we know that family support, those natural supports, are really instrumental in people's recovery. So I know they do the family forums and, family education classes and programs. And the sense I get is that that's the experience they're a little more focused on, whereas we tend to be more focused on the individual who is the recipient of the mental health services. Now, we do also have family supports, particularly for parents and caregivers who have children who are not adults who are going through these services. And there's definitely some overlap, certainly highlighting voices of lived experience, but that's kind of the difference.
Okay, so let's just throw this open to both the organizations that are here. Any further questions from anybody in the room? Veronica.
Yeah, thank you. I have a question for both of you. So mental health's been coming up a lot in at least the committee meetings I've been in, both from thinking about mental health services, but also like lots of service providers talking about increased distress they've been seeing, although, it's good to hear some signs that like things might be getting a little better. And in particular, folks involved in the criminal legal system, like at the jail and places, saying that seeing increased mental health challenges there. So I guess a real big broad question is, from where each of you sit and like serving the clients that you do, what do you, what needs do you see in the community that we might not be thinking of? Not that we can necessarily address right now, both in terms of like stuff that maybe your organizations could do within your purview, say, if you had all the resources in the world, or stuff that's like not really in your ballpark, but that you're aware of because of the interactions you're having, if that real long thing makes sense. And this is for both of you.
I can take part of that from our standpoint. I think where our biggest focus in that aspect would be building the relationships with all of the organizations and businesses and providing trainings and presentations so that they're more aware of, as Melanie said, some of those early signs. That's where it's going to be most beneficial. When people get to that point of crisis, it's a little bit harder to deal with. But if we've got, lead officers or staff in a school or anything like that, that are aware of those signs and like those early intervention things so that they can connect people to the services that they need earlier, that's going to be better for us. A lot of it's going to be opening up those doors. And really for us right now, it's bandwidth. We don't have the people to be able to do all of the things on our wish list of educating the community.
Yeah.
Go ahead.
Sure. Yes, I would echo all of that. Thank you, Tiffany. It's no secret bandwidth is a huge challenge across the board right now. And, a couple other needs that we're seeing, and, this one is probably not a surprise either, but transportation continues to be a real struggle for folks for a number of different reasons. As well as, I think that we see a lot of folks who perhaps have a number of service providers that they're connected with, and the bandwidth of those service providers is maxed out. And sometimes people fall through the cracks that way. And I think that a lot of people, what they're really looking for is FaceTime with their providers. I think the way that sort of how care management services and different services have transformed over the past several years, there is a lot less opportunity for providers to be meeting with people in their communities, in their homes, helping them to navigate that community inclusion piece and really having that connection that is more than a phone call or more than a once a month meeting. And, that is something that we hope to find more capacity to do. Something that we're really interested in doing is setting up more kind of mentoring programs. We see a lot of folks struggling with social anxiety who just want a supportive person to help them get out there. Yeah. Randy, do I see your hand for the question about that?
That gets for both of you. I think a lot about this stuff, probably more than I should. But one of the things that I've observed from being at a school board and very involved in school, in meeting and talking with principals and superintendents and that, is that for me, early intervention means when they're young, right? Because whether they're in a family that has mental health issues or if they themselves have those. And there's social workers and many other very qualified people in the schools who are working with these kids in many ways, and in some cases families. And so my question is, do you see any value in training more people in the schools that are working with these kids, and also to put a plan together for those kids? And I think a lot of it for me is socialization. They know that 30% of the kids are isolated and aren't part of any activity or whatever number that is per school. And they know these kids need help. They just don't, it just doesn't happen. So that's my thought. And maybe that's not a question.
I can speak to in terms of the education piece a little bit in terms of schools. One thing that our initiative that we're really trying to be a part of is getting this youth mental health first aid training to educators, which is specifically for adults who are working with young people about recognizing warning signs. And a big part of that is connecting people to kind of their natural supports. And that includes opportunities for socialization that they may have access to. Now, getting over that barrier of feeling comfortable and able to engage in those things is another challenge to look at. But I think really supporting educators in learning how to do what we might call like positive resourcing with kids. Like, what do you have? What does feel good? Who do you turn to? Because I think also a lot of what, and kids as young as like 5 and 6 can give you answers to that, right? And I think a lot of what happens for children and even adults with mental health problems is we get told, okay, here's what you need to be doing. Here's what will help you. Here's who you should be spending your time with. So I think part of it, and this is something we really try to talk about in our education, is that shift in perspective to the voice and choice of that individual. And I think that that helps to motivate those connections and that engagement. Yeah, it's a challenge for sure. And that there's no simple fix for it. But that's one kind of reframe that I try to work with people around.
Okay, thank you. That was helpful.
I think it's great, everything that Melanie said. One of the interesting things that I've come across with in some of the counties that I've worked with is those social workers in the schools may not necessarily be comfortable with talks of suicide and things like that, and they don't know what to do. So there's a lot of training there that needs to happen as well. And we have those trainings available through the mental health first aid, safe talk with suicide alertness. There's opportunities there. We just need to be able to capitalize on that. And like, it always comes down to, it's the bandwidth that we have of having the ability to have those folks go out, make those connections, and then do some of those trainings. But I think once we're able to do a lot of that, we'll be able to make people much more aware and more confident in their skills to be able to support people.
I have 2 questions. I think they're both for Tiffany. You mentioned the Tompkins County Suicide Prevention Coalition. And I have to be honest, I never heard about that until I started organizing this meeting. And I know that our county mental health services department is there and maybe some other county departments. Can you just say a little more about like how often you meet and if there's any particular goals of the group, or it's just kind of a sharing? Or
There are goals. I've been on it once, I think.
Okay.
But
you're new.
there are several mental health organizations in the community that are part of that meeting. It's interesting, every single county has a coalition, which is really great. But it's really all a shared goal of educating the communities and access to services and making sure that we can support people where they are in the beginning of their mental health crises.
Thank you. My other question, from the very beginning of your presentation, you talked about the origins of your organization, which was also news to me. It's interesting. And you said that it started out as a reaction to Cornell student suicides. I'm wondering, does Cornell support the organization in any way, financially or any other way?
Financially, no. We have been partnered with them a lot. They've got a peer support program there for students that are struggling with mental health issues. And we do a lot of active listening training with the people that are part of that group. I am working now to build stronger relationships with Cornell. I've had a couple of meetings this week and I've got a few scheduled for next week to kind of see where we fit and how we can better support each other in this, because it is still a very real concern with the school population.
So you do trainings for some of their people in their community?
Yes, active listening training we do.
Thank you.
Yeah.
Any other questions for either? Veronica?
I have a comment before a question, really.
Sure.
Well, first, general thank you to both of you and both your orgs for all the work you've done. And I've gone through some of the training actually that Tiffany's mentioning, including I used to be a Cornell EARS counselor back in the day. EARS stands for Empathy Assistance and Referral Services, and it's changed format now from how it used to be. But I know the folks in it have learned a lot from the training model developed that SPCS uses anyway. I've taken the applied suicide intervention, skills training that you mentioned, and it was really good. I know different people run it now, but I'd recommend it to everyone. I've had the little booklet about it in my wallet ever since. I haven't had to pull it out very much, but it has made me more comfortable in bringing up the topic of suicide if it seems like it might be relevant. So appreciate that. And I guess I want to highlight that kind of thing. None of this makes me a mental health professional, but I hope that I'm just an example of many, many people where a little bit more of this facility with talking with these kind of issues can get out in the community. Anyway, you can cut me off if I'm taking too much time, but a couple of questions. I kind of on that note, I'm sure a lot of people have mental health challenges and like don't know that they do or don't want to call it that, or there's like, you know, stigma around calling into something that's called suicide prevention or called the Mental Health Association. So what have you all learned or recommended about connecting people with support who are not looking for it but could benefit from it or don't want it to be called that?
A lot of it is meeting them with the terminology that they want to use. So if they connect with us and they're identifying themselves in some type of way, we try to use the language that they're using and certainly not label. There's no judgment, no anything. And one of the things that we really foster on the crisis line is we are here to listen and help you guide yourself to your next goals, your next steps, how you're going to keep safe right now, and then opening up those resources if they need them. But the stigma is a lot of trouble, and there's people that are scared to give their name to us because you're going to call the 911 and they're going to take me to the hospital, and it's really scary. But really understanding the process that actually happens is something that we're trying to break the barriers down to. So connecting with different resources that we have in the communities. And if somebody calls us, like, what's that step happen? So then when we have the callers that need those additional resources, we can say, once, you know, we make this connection, here's exactly what's going to happen to make it not such a scary process for them. Would that help at all?
Yeah, that does. Thank you.
Yeah, I think our organizations are very aligned in that way. I like what you said, Tiffany, about echoing back their language, because it is really a kind of culturally specific concept to just label it mental health in the first place, right? There are a lot of different ways of viewing and naming this thing that people deal with. So I think that, yeah, meeting people where they're at with it is super important. I think another thing we try to do is to help people consider many different options and avenues to support. So one thing we frequently tell people, especially in our trainings, is you can start just talking to your primary care doctor, right? No one needs to know why you're in that waiting room. And even just when you go in for your physical, you know, you've said that you're feeling really low energy and you're crying a lot and you don't like it, you know, maybe share that with your doctor. We also, one thing we find ourselves doing a lot is supporting people who do have others that they're concerned about, and kind of either role playing or brainstorming about how they can have those conversations with those people that they care about, because that is a lot more likely to land than just giving them a phone number and saying, call this peer support line, right? So I think those are also two kind of approaches that we try to work with people. Like, what are the supports that you have that are already there, or that the person has that are already there? And how can these be of benefit for this issue that you're dealing with, this distress, whatever you want to call it, if that makes sense.
Well, I want to thank you both very much for joining us today. I learned a lot, and it reinforced the idea that we are a community rich in not-for-profits doing like really amazing work, and that most of us really don't know don't know the depth of all the things that are going on. So thank you, thank you, thank you. Okay, we are going to move on then with the rest of our meeting. Melanie, while I have you up there, if at some point in the next week or so, if you could send a copy of your presentation to the email address you got the Zoom invite from, we appreciate that. It'll be part of our referenced in our minutes.
No problem. And I'm going to drop that information about our peer support line in the chat here too, just so folks have that.
Thank you.
Okay.
All right. We are going to go slightly backwards in time to the county administrator's report, if the county administrator has a report for us.
Hi, thank you. And I'm sorry I was a few minutes late jumping onto the meeting. I don't have much of a report. I just wanted to follow-up from our previous discussion at the last legislature meeting, where we were discussing recent events and issues around the Human Services Building and follow-up that was occurring. I wanted to make the committee aware that we've had another follow-up meeting with departments and staff involved in responding to those events to discuss lockdown procedures and also to talk about next steps within departments for looking at the various floors and security measures and site-specific plans that could be put into place, and some other issues or other ideas that have emerged within the building among the departments that we're going to be looking at. We're continuing to follow up also with the Department of Emergency Response over the use of siren in response for emergency notifications, and our Director of Facilities, Arel Lamaro, went to the Human Services Building to look at the overhead intercom system. So those are among the follow-up items that we're working on. We have, there's another meeting scheduled with departmental leadership later in the month. So happy to answer any questions there.
Any questions for Lisa? Okay, thank you, Lisa.
Thanks.
We are moving along. We are going to now go to housing. We have an information item, Town of Dryden contribution to the Community Housing Development Fund. No action is necessary, but I see Megan McDonald's is here. Megan, you want to say anything? You had a nice memo in there with a lot of info, but do you want to say anything right now?
I will save you all time and just be here for questions if you've got any.
Thank you. Any questions for Megan? Okay, thank you. All right, moving along, public health and mental health departments. We have two resolutions. The first one is a budget adjustment, health department vehicles. Frank, do you want to say anything about this one?
Sure. This is actually asking for some funds from the Green Fleet Initiative to finish off the electrification of our fleet at the health department. We have four vehicles this year that we're trying to replace, and the costs are a bit more than we had originally budgeted. I do believe this is the first time we've asked for Green Fleet dollars for the entire electrification project. The rest of it had all been completed through rollover at the department.
Thank you. Okay, is there somebody who would like to move this resolution? Travis moves, Randy seconds. Any discussion, questions, comments? Okay, let's have a vote. Randy,
Yes.
Travis,
Yes.
Mike,
Yes.
Veronica,
Yes.
and I'm a yes, that's unanimous. Thank you, everybody. Second resolution, appropriations from Emergency Disaster Assistance Fund and Contingent Fund for community surveillance testing for Tompkins County residents related to COVID-19. Frank? Frank, do you want to introduce that? Did you freeze up there a little bit? Okay, will somebody like to move this, get it on the floor? Travis moves, Randy seconds, thank you. Looks like we've temporarily lost Frank. Is there anyone else that can speak to this?
I can give it a shot. This is Lisa.
Thank you, Lisa.
So this already was discussed at Budget and Capital earlier this week. And this is recognizing that the FEMA reimbursement for our community testing up at the mall site will change as of July 1st. and we believe that it will change. Our best information is that it will go from providing 100% of the cost of testing to 90%, and there will be a 10% local share. We have an interest as the county to continue offering the community testing site in partnership with Cayuga Health Services at the mall as we continue surveillance on the prevalence of COVID-19, particularly as we move into the fall months with the return of students. We're hoping that that the rates will continue to be declining, and that in the future we will no longer need this. But it being that it's going to, it takes resources to maintain the site, and if we were to close the site and have to reopen it, that would be problematic. So I think this is our attempt to keep the site going, and that it provides a ceiling over which we wouldn't spend money, and it's based on what we're currently paying weekly, 10% of what we would be paying weekly for the local share to maintain this site.
Thank you. Randy?
Yes, I realize Frank's not here, but I'll put you on the spot, Lisa. So the county pays for renting the facility at the mall, and then we pay Cayuga Medical, or FEMA does, for each test. Is that how that works?
It's we are reimbursed for each test that occurs, essentially.
But the cost of staffing it and those the staff are county employees.
No, it's Cayuga Health Systems.
Okay, those are all Cayuga Health.
Cayuga
Okay.
Health Systems employees at this point. Yes.
Okay, I just wasn't sure how that worked. All right, thanks.
Yeah.
You. I see Frank trying to reconnect. Hello, Frank. You back with us?
Yes, can you hear me now?
We can. Thank you.
I'm sorry about that. I must have sneezed and my computer decided to restart.
That's okay. Lisa did a very able job as interim health director. For you're back on duty now. So she did give an excellent summary, but if there's anything you want to say, now is a good time.
Yeah, no, I think I heard most of it through my phone, but to answer Randy's question, we pay per test to the hospital. We don't pay for any of the costs. We're not renting space. We're not paying for staff. They have set up the operation. We just pay the per test cost.
What do we pay per test, you know?
I don't know that we share that information publicly because it's protected information with the hospital, but Lisa might know differently.
I don't know differently.
I have a question. I have seen in the news, but I haven't dived very deeply, that Congress is failing to renew, like a COVID emergency funding. And, it's just one of many bad news stories. So I haven't wanted to spend much more time with it. Is this going to affect us? Do we know in terms of, any of it, reimbursements or tests or vaccines or any of it?
Yeah, I think the biggest thing that we're seeing right now is the uninsured, right? So when this all started, there was federal support for the uninsured to have no cost. And that's the part that has the federal legislation being delayed and not passed has impacted. Our ability to provide this testing has kind of taken care of that problem. So it doesn't exist. Where it does exist is in the treatment of COVID. And so the hospital would be in the position of having to use other mechanisms for uninsured care because they're not guaranteed federal funding for COVID uninsured care.
So you're saying we are covering that gap for now?
On the testing front, yes, because the county will cover the county will cover for any test that is not reimbursed by insurance as long as the person is a county resident.
Okay, so I'm sorry you just said this, I didn't quite absorb it. So you said the hospital is going to be looking for ways to cover vaccines for uninsured, is that what you said?
No, for the healthcare. So say somebody ends up in the hospital,
I see.
right? There was, under the COVID legislation, there was a direct line to funding for the uninsured for COVID care. And now the hospital has to use its other charitable ways of getting funding for the uninsured to cover those costs.
I see. Thank you. Any other questions or comments about this resolution? Okay, let's have a vote. Veronica,
Yes.
Mike,
Yes.
Andy,
Yes.
Travis,
Yes.
and I'm a yes. That is unanimous. Thank you, everybody. Frank, we're going to have you also do a departmental update. You can do it now, you can do it later. It's your call.
Sure, I don't have a lot to add. The one thing I did want to share is that the branding effort for the new name and logo of our new joint department is well underway, and we're excited to be close to a name proposal. I'm not ready to announce that just yet. We'll be working with the Community Services Board and the Board of Health for their review and concurrence, and then hopefully we'll be bringing that to all of you in July to look at what we've come up with and get general concurrence so we can move forward with the next steps of coming up with a logo and other branding materials. So progress is still moving forward, and we're excited to be close to presenting something to you all.
Excellent. Thank you. Any last questions for Frank? Okay, Frank, thank you very much. Moving on, Office for the Aging. We have a resolution, budget adjustment, Tompkins County Office for the Aging, unmet needs, purchase of an all-electric vehicle. We have Lisa Monroe with us.
Hi.
Hi, Lisa.
Hi. Yeah, so this is just pretty much like what Frank had earlier with his budget adjustment. It's just offsetting what COFA has available to spend on the electric vehicle. And this will supplement a hybrid vehicle that we also purchased this year.
Thank you. Somebody want to move this resolution? Veronica moves. Thank you. Randy seconds. Discussion. Okay, let us have a vote. Oh, sorry, Mike Sigler.
I was just wondering, is this replacing a car? Or is this it sounds like it's just, is this a new car or is this replacing something?
So we do have one vehicle right now. So we purchased two. This will be the second one. So it will be replacing that Ford Fusion that we have. And so we'll have a hybrid and an electric.
Any other questions or comments? Okay, let's have a vote. Travis,
Yes.
Mike,
Yes.
Randy,
Yes.
Veronica,
Yes.
and I'm a yes. That is unanimous. Thank you. Lisa, anything you want to update us on, either now or later? Your call.
Yeah, I just have a quick, our senior farmers market nutrition program, the coupon booklets that we offer to income eligible folks that are over 60. We hope to have that program up and running in July, receiving all the booklets and inserts by then and get it up and going by the second week of July so people can get those coupons and use them at the farmers markets.
Just in time for peach season.
Yes. That's all I have.
Thank you. Any last questions for Lisa? Okay, thank you.
Thank you.
Next up, Youth Services Department. We have one resolution, approval of intermunicipal recreation partnership agreement. Kate Shanks Booth is here. Kate, do you want to set us up?
Yeah, so this is just a resolution that allows the county to sign the new 5-year contract. The last one that we entered in was 2018 to 2022. So this current contract for expires at the end of the year on the 31st. And so there has been no recommended changes from any of the municipalities in the contract. It's exactly the same, except numbers will shift based on the formula we use and the programs that are offered in 2023 and beyond. But this is just permission for the county to enter into the contract and for Lisa to sign it before the end of the year. So, and because there's no recommended changes, we're just trying to get ahead of it all other municipalities, except I think the town of Ithaca have passed resolutions which they can sign. So it's just part of the process.
Thank you. That is excellent news. This is a big agreement it involves a lot of parties, and there have been times in the past, I guess, when there's been more discussion. It's nice that everyone seems satisfied with it if they're not proposing changes.
Yes, we're really happy that this has been there. It's a great group of people to work with. And I think the agreement, the changes that were made for the 2018, 22 to 22 contract were really good. So everyone seems happy.
And is it still generally true that it's funding is a third county, a third city, and a third the towns?
So the county pays a quarter, the town and city of Ithaca pay a quarter, and then the last quarter of it is divided among the smaller municipalities.
Thank you. I had my fractions wrong. Okay.
Close, yeah.
Can somebody move this resolution, please? Veronica's moving. Randy's seconding. Thank you. Discussion, questions, comments? Veronica.
This is incredibly minor, but in line 10, when it says December 31, 2027, is that supposed to be 2022?
No, it's a 5-year contract. So it would run from January 1st, 2023 to December 31st, 2027.
Okay, that makes sense. I thought the state was like, maybe I'm misreading it. I thought it was like, so this is saying you can renew for an additional 5 years as long as we decide before 2027 to renew for an additional 5 years?
Yeah, so we'll come back to you in 2027 with either recommended changes or just a renewal of the same contract before 2028 begins.
Okay, I think that makes sense. Thanks.
Any other discussion? In 2027, I'm going to be eligible for the seniors farmers market coupon. So in fact, well before that, really. Okay, last discussions. Let us have a vote. Veronica.
Yes.
Andy.
Yes.
Travis.
Yes.
Mike.
Yes.
I'm a yes. That's unanimous. Thank you, Kate. Thank you, everybody. And Kate, would you like to do a departmental update?
So we are going to be in the process of hiring a new deputy director, and we have another position, coordinator of community youth services, is going to become vacant at the end of next week. So we're going to be doing some hiring, and we are in the process of getting ready for our budgets. So we're working with our local commissions for Ministry of Youth Services, our department, and our resource advisory board to do allocations for our agencies, and then the municipal youth system. So we're knee deep in numbers.
Excellent. Okay, thank you. Any last questions for Kate? All right. Let's see, we're up to other department updates that we haven't gotten to. So let's see, we had Kate, we had Frank, J.R. Claiborne, Veteran Services.
All right, good afternoon, everyone.
Afternoon.
All right. Yeah, for me, actually, I'll say first, thank you for the people that you invited to talk about mental health services here locally. That's something very important in our in the veterans community. So it's really good to hear more about the resources that we have locally. And hopefully, well, I'll just say it this way, hopefully I'll be able to share some information here in the coming months about a new initiative that's in development. That'll be coming our way. One of my updates, I know Mike Lane brought it to you or announced it at the legislature meeting, but I just want to share officially myself that I was proud to be the invited speaker at the Dryden Memorial Day parade this week. Last month. I marched with the Dryden American Legion, and then also, as I said, I was able to be their speaker for the meeting, and then went back to do some outreach at the Dryden Post, American Legion post with the Veterans Memorial Lodge. Veterans Memorial Home, let me say that right. One thing I'd like to share with you all is that this end of this month, June 29th through July 4th, in Chemung County at Amira's Park, Eldridge Park, there will be the moving wall. And this is a half-scale replica of the Vietnam Memorial Wall in DC. This is going to be in, as I said, the 29th through July 4th. And on the 29th, they're going to have an opening ceremony that will include a wreath laying ceremony. One of the things that I'm bringing to note here for us, Tompkins County will be involved, is that there are plaques that are going to be dedicated from the wall that feature the names of the lost from each of the counties that are being involved with this. So that includes Tompkins. So I know our local VVA, Vietnam Veterans of America chapter 377, they've been involved with helping with that. And I'm talking with them, and we'll have some more information about the plaque that will be brought back to Tompkins County and to find a home for it locally.
Thank you. Questions for JR? Okay, JR, thank you.
All right, thank you. And happy Juneteenth weekend.
To you too. Next up, Kip Kephart, Department of Social Services.
Hi. Thank you, Dan. And we are I would say there's just two focus areas right at the moment that are kind of first and foremost. One is that we continue our process of hiring at social services, or attempting to. We are seeing, I think I've said before, we are seeing a tremendous number of people that have significant longevity at the department depart, many of them after 30 years. And so we are actively recruiting and hiring for a number of different positions and trying to space that out so that we're able to keep the work going as well. But it makes for a busy time, and it's a tough labor market. We have offered a number of positions and been turned down by people. So that work is ongoing. And then, as Lisa indicated, we've had a number of concerning incidents around the building, and so we've been doing some after action work to really do the best that we can to be planful for potential upcoming events, and to continue to try to provide training and direction to staff as much as we can predict with things like this. We're meeting with our security team to continue to review what are our processes and how do we ensure the best that we can, the best safety plan for the building. So, and then in addition to those things, trying to bring in after the last couple events, bringing in some EAP supports for staff, just to kind of allow for some debriefing and support. So that's kept us pretty busy for the last couple of weeks. We're starting to see some of the legislative changes that we tend to hear about around this time of year. So we're getting ready. Next month we'll have an association conference and find out more of what's going to be impacting the budget and how our programs will change. So lots of things in flux right now, and we're trying to work on all those things. So.
Thank you. Questions for Kit? Randy.
Yes, hi, Kit. You spoke about this maybe the prior meeting or meeting before, about homelessness and how we're putting people in hotel rooms during the colder months. I think it's October 15th through May. Is that correct? Or I forgot what that was, but
yeah. Oh, sorry, go ahead.
So my question is, and I know a large majority is paid by either the fed or state, and the county picks up a smaller portion. Do we know the total amount of housing people during that period, regardless of what government entity is paying for it?
So yes, we do. I don't have those numbers on the tip of my tongue right at the moment. So there's two different programs that I think you're referring to, Randy. One is our Code Blue program, which is the program that is 100% state funded, that runs generally. It's Code Blue basically is sheltering that we provide under 100% state funding when the temperature drops 32 or below with wind chill. So we contract with the shelter to provide that basically as a guarantee from I think it's either middle of September or early October, I don't remember, until like the middle of April. But we can see code blue sheltering happen outside of that contracted range time based on temperature, because we contract with that just so that a provider can actually planfully be able to service people when we know that it's likely going to be cold. So that's one program. And then the program that is year round to provide sheltering to people is temporary housing assistance, which is a program that is part of the state program of temporary assistance. So that provides sheltering year round, but there are more qualifiers for people than with code blue. And that's the one where you're referring to, I believe, it depends on what specific program people fit into, but there can be a local cost depending on what program somebody qualifies for. So, so we have, what I would say is that we have clear code blue numbers. I think I would have to look and see what numbers we can access and how quickly for the THA. That's a more complicated because we're entering those numbers into the state system. But the code blue numbers we typically have pretty easily accessible, but I don't have them right now. We are seeing very high numbers for our sheltering population. I believe right now, I believe we have 87 people in shelter, and considering the fact that it is June, those are pretty high numbers. But I think that we are seeing the effects of the growing cost of housing in our community, and we are seeing the effects of some of the challenges that I think people have experienced during the pandemic. So that is, that's the nature of kind of where things are at right now.
Okay, thank you. I know it's not easy to dig into some of that data, but whatever you have at some point
Sure.
would be helpful. As we start thinking about whether we're going to try a solution for homelessness in Tompkins County in Ithaca, it'd be helpful to know, what it's costing us now. I mean, a solution may make sense. I mean, financially. That was my thought on that. Thanks.
Sure.
Any other questions for Kit? Okay, well, thank you, Kit. Ken Clark, Office of Human Rights.
Okay, good afternoon. Just a couple of brief notes. So far, our list of Juneteenth events have gone quite well. The keynote address on Monday afternoon was given by Annette Gordon-Reed of Harvard, the historian who wrote the book on Juneteenth. And the event was attended by over 70 people. And has gotten right as of now 142 views. And it was really an excellent presentation that she gave. Today was a Black Business Expo, which featured local Black-owned businesses, and as well as food provided by African-American caterers available for purchase at the Tompkins Center for History and Culture from 11 until, well, 2, I guess it would have ended about 12, 13 minutes ago. But it was a good traffic flow there, a number of folks coming in and out of the expo to learn about what Black businesses in the community have to offer. On this coming Friday, from at 12, I think it is, there will be a viewing on YouTube, and I will put the link to for that viewing in the chat of a Southside African American historical tour, which was led by the former chair of the legislature, Leslie McBean, Claiborne. It's about a 40-minute video, and a very interesting and informative video about the experience of African Americans living in the South Side of Ithaca that can be traced all the way back to the early 19th century. And so these are the three major events going for YouTube. I mean, going on for Juneteenth, and the video will remain on YouTube, under the county header there. On tomorrow, I will be speaking at a summit being sponsored by Reuse in Ithaca here, and I will be talking about reuse and human rights as part of a larger conference, which is drawing folks from throughout the Southern Tier region, and is being co-sponsored by one of the departments at Syracuse University that's involved in environmental justice and sustainability issues. Let's see. And also, we are also planning a kickoff event in conjunction with the Downtown Ithaca Alliance for its Pride Week series of events that begins on Monday, June 27th. The kickoff event will be on the 27th at 11:30 a.m. And on the Commons, and we are securing the exact location, most likely the Bernie Milton Pavilion. And it will be a relatively short ceremony of about maybe 20 minutes or so, in which we will have acting Mayor Laura Lewis speak, and also newly elected legislator Greg Mezzi will be speaking as well. And so we invite you to participate and join with us for that kickoff on the 27th. So that's all I had.
Wow, thank you. Questions for Ken? All right, thank you.
Mm-hmm.
Next up is Cindy Wilcock, Human Services Coalition.
Hi, good afternoon, everybody.
Afternoon.
Just very quickly, we are also kind of knee deep in the review process for the county funding for your not-for-profit funded partners. So we're smack dab in the middle of that, getting ready for our recommendations for the budget for the county. So that's all we have going on.
A lot too. Thank you. Questions for Cindy? Okay, thank you, Cindy.
Thanks.
Comments from committee members and liaison assignment reports. Anybody have anything for us? Okay, well, I'm going to mention that our next meeting in July is scheduled to be a joint meeting with the Public Safety Committee. And this was Rich John's idea. And he has sent me a few ideas. This is a while ago. And to be honest, I haven't focused on this very much yet. So I don't have a lot of info. But what I remember was one of the topics he thought would interest both our committees was mental health services in the Tompkins County Jail. And another had to do with opioid overdose deaths. There was some, there was some questions earlier in the year about whether we're counting them accurately. I think we are, but it was just, we wanted to take a little time to focus on it. And I think Rich had some other ideas too, but I just don't have them in front of me right now. So I will circulate that information as soon as we work it out, and I will start focusing on this more. And the way that the meeting likely will work is that each committee is going to meet separately and do its own business, and then we will meet jointly to do joint business. And I don't know exactly how that's going to work yet, but it'll be basically at our same time, give or take. And like I said, as soon as we work out the details, we'll make sure everyone's on board with that and can accommodate. So any questions about any of that? Okay, we had a couple of budget adjustments and transfers for information only. Did anybody have anything they wanted to ask or say about that? Is there any other business today for this meeting?
Dan, we had an appointment.
Oh.
And minutes approval.
Oh, yeah, I just skipped right over that. Thank you, Katrina. Let's do the minutes approval. Is there somebody that would move the minutes, please? Veronica moves, Mike seconds. Any discussion on the minutes? Okay, let's have a vote. Mike,
Yes.
Randy,
Yes.
Travis,
Yes.
Veronica,
Yes.
and I'm a yes. And then an appointment, which, let's see, we have Mary Orseo, I think that's how you say your name, to the Mental Health Services Subcommittee, Mental Health Subcommittee. Is there anybody who wants to move? Is that the only one? Oh, two. We have two. And Jessica Connor to Tompkins County Community Services Board. We got both? That's all? Thank you. Anybody want to move those two? Travis moves. Mike seconds. Any discussion? Okay, let's have a vote. Veronica?
Yes.
Mike?
Yes.
Randy?
Yes.
Travis?
Yes.
And I'm a yes. So that's unanimous. Okay, now is there any more business for this committee? In that case, we're adjourned. Thank you very much, everybody.
Have a good day.
Thanks, Dan. Have a good day.
2:22.